Hair loss is a common problem that affects individuals of all ages and is caused by a variety of factors. While hair loss is more common in women, permanent hair loss or baldness is more prevalent in men. Thanks to advances in technology, there are different methods available for treating this condition that bothers individuals. Hair transplant techniques are applied both in the world and in Turkey. The most suitable method for the patient is analyzed, and the treatment process begins. Since the 1990s, hair transplant techniques have been rapidly improving, and a more natural appearance can be achieved today. Hair transplantation techniques. Hair transplantation techniques are increasing every day. There are two well-known and commonly used methods. In both methods, live hair follicles are transplanted. The methods are performed under local anesthesia. The reason for the division of the methods is the difference in the way hair is removed. In the first technique, hair follicles are taken between the two ears and leave a permanent line-shaped scar. In the second technique, hair follicles taken from the back of the head are applied to the area where hair transplantation will be performed, leaving no trace. The best hair transplantation technique is determined by the hair loss rate of the person, the location of the donor area, and many other factors, by the hair transplantation specialist. Foot technique in hair transplantation. Until the early 2000s, the most preferred and applied hair transplantation technique was the foot technique. Later, due to the development of technology and the emergence of new methods, the usage rate decreased. The foot technique, one of the oldest hair transplantation methods, involves cutting the skin layer with hair follicles to be used for transplantation by removing it from the area between the two ears. After the 3 square centimeter skin layer is completely cut and removed, the hair follicles in the area are taken by the nurses and then transplanted to the area where the application will be performed. After the procedure is completed, the cut area is sewn. This technique, which has a longer recovery period than other methods and leaves a scar, is not preferred as much as before. The advantage of this technique is that hair transplantation can be done faster since hair follicles are cut and taken as a whole. Fouet technique in hair transplantation. For the last 15 years, the most preferred and developed hair transplantation technique is the Fouet technique. In the Fouet technique, hair follicles are collected one by one from the area between the ears. Hair follicles that are removed with the help of a micromotor device or a manual punch are stored in a cold environment with a special solution. After the area where hair transplantation will be performed is prepared for the operation, the hair follicles taken are placed in the area. Since hair follicles are placed one by one with the Fouet technique, the duration of the procedure varies depending on the number of hair follicles that need to be transplanted. Although the duration of the procedure is longer with this method, the fact that the recovery process is faster, and no trace is left after the operation, is among the reasons for its preference. Manual punch hair transplantation. Manual punch hair transplantation is actually a type of Fouet technique. Punch is the name of the tool used to collect hair follicles from the donor area. This tool is not electric. It creates small holes around the hair follicles and collects them. It was used especially in the early days of Fouet technique but later replaced by micromotor. Micromotor hair transplantation. Micromotor hair transplantation is also a type of Fouet technique and is currently the most preferred method among hair transplant techniques. Micromotor punch is an electronic device that allows for faster collection of hair follicles from the donor area, making hair transplantation faster. Hair follicles live within the skin but rapidly lose their vitality after they are separated from the head area. Therefore, the live percentage of hair follicles collected with micromotor punch is higher, increasing the success rate of hair transplantation. DHI hair transplantation. Direct hair transplant, DHI, is a method of direct hair transplantation, as the name suggests. It is one of the newest hair transplant methods and is used in conjunction with the Fouet technique. Hair follicles collected one by one with the Fouet technique are transplanted with the DHI technique. The difference between this method and the Fouet technique is that the special pin allows for opening channels and hair transplantation at the same time, which minimizes the duration of the procedure and increases the success rate. Another advantage of this method is that it allows for dense and intensive transplantation. It is also used as a hair thickening method, not only in areas where complete hair loss has occurred. However, if there are not enough hair follicles in the donor area in individuals with complete hair loss, the possibility of more intensive transplantation may not be available with this method. Robotic hair transplantation. Robotic hair transplantation is the second newest method among the hair transplant methods and is performed by a computer that controls the hair follicle collection and transplantation process. It is the most popular method among hair transplant techniques. It works on the same principle as the Fouet hair transplant technique, with the only difference being that the precise arms of the procedure are applied by a computer. Hyperbaric hair transplantation. The hyperbaric hair transplantation method is used to speed up the recovery process among hair transplant techniques. Oxygen is used in this method. The wound healing power of oxygen facilitates the healing of the holes opened during the hair transplantation procedure. This method is applied after hair transplantation, not during the direct hair transplantation procedure.